Here at Denver Health, the city's public hospital, they are seeing more sick people than they've ever seen before. Not because more people are getting sick, but because today more people who are sick or hurt have no place else to go. This is the safety net, the last resort.
You doing okay, Mr. Hazumi?
Yes.
Mesmin Hazumi came in with chest pains. He used to have a job, and he used to have health insurance.
Yeah, I used to make 40 to 60,000 a year. Right now I'm making 200 a month. How many people can live off of that?
Now just relax, breathe normal, don't move, sir. Perfect.
I'm scared that when those bills come, how am I going to be able to catch up with them? I don't know what to do. Sometimes I want to take my life because of those accumulation of bills.
Ted Carpenter is in a similar position.
So I just need to see an ID and an insurance card.
Insurance?
Now, you working anywhere?
No, ma'am.
After being laid off from his job operating heavy equipment, no insurance.
Need a print signature for that discount program.
When Ted had an accident recently, he went to the private hospital near his home, like he used to do when he had insurance. But they turned him away to Denver Health.
I'm used to having insurance, and I'm used to being able to pay for anything, and it's just stressful right now. I'm not sure what's going to happen. If I knew I was going to go to work next week, back to work, then it wouldn't really bother me too much, but it bothers me now. I don't know what's going to happen.
And a couple of breaths with your mouth open.
Dr. Kathy Erickson works the ER here at Denver Health.
I see every patient, regardless of their level of pay. We have been trained here to get tests we need and offer the best patient care, regardless of someone's ability to pay. And we can't really legally ask that question. We treat all patients the same, whether they can pay or not.
Y vamos a escuchar al corazón, okay?
That's because Denver Health, as a public hospital, is required to treat all comers, health insurance or not. And as the economy gets worse, they are getting more charity patients at their front door, 20% more than a year ago. Most are newly uninsured. One study says every time the unemployment rate goes up just 1%, another million-plus Americans lose their health insurance. So public hospitals like Denver Health are now struggling to survive. Denver Health's CEO, Patricia Gabbo.
We're sort of the canary in the mine shaft. Whenever anything starts to fall apart in society, it shows up at our front door very quickly.
And it's not just because they have to provide more free care than before. But with state budget deficits projected in the hundreds of billions of dollars, government funding is drying up as fast as patients pour in, down by almost 10% just since the recession began. Peg Burnett is Denver Health's chief financial officer.
Just because you have more uninsured or underinsured patients, is there any magic pot into which to dip?
No, actually right now it's quite the contrary. We receive a substantial amount of government funding for uninsured patients from the city and the state and the federal government, but actually in the last 2 years, between 2006 and 2008, that funding stream has decreased.
The government funding stream?
The government funding stream.
When the economy gets worse, our demand goes up, but our funding streams, which largely come from the government to fund those patients in some way, tend to be cut as cities, states, and the federal government go under more stress in bad economic times. And so we usually see ourselves in kind of a double whammy situation in a bad economic time.
That double whammy is playing out across the whole country. Only 2% of all the hospitals in the U.S. are public hospitals, but they supply 25% of the nation's charitable care. And the numbers are shocking. Denver Health projects that the amount of charitable care they give away will rise almost 30% this year over the levels of 2007 to $355 million.
If you compared it to General Motors giving away $300 million worth of cars with no source to pay for that, it's something to think about.
Anyone you lift?
Many public hospitals are drowning in deficits, which is leading to cuts in essential services. Of 4,500 hospitals in a recent survey, half right now are at risk of insolvency.
We are hearing from all of them that they need some help with day-to-day operating money. It isn't just new programs, it's just to keep afloat, to do what they're doing now, to do it well, to serve everybody.
Chris Birch of the National Association of Public Hospitals says they're already cutting to the bone.
The public hospital in Las Vegas recently had to cut out their pediatric oncology program. That is going to hurt people throughout that region, not just the uninsured. At a certain point, you can't operate every service at 80%. You really have to make some hard choices about what services you provide, what services you don't provide.
The bottom line is, without financial transfusions or radical reductions, hospitals could die. But Denver Health doesn't plan to. Instead, it has put innovations in place and become a case study for staying alive. And the first weapon is community clinics, like this brand new one called Park Hill. There are 8 of these clinics, and they are the major innovations because they keep people not just out of emergency rooms, but out of hospitals altogether. Denver Health calculates that this saves at least $19 million, as well as improving the quality of care.
The bedrock of any new healthcare system in America must be primary care. Patients need a medical home.
A medical home for families who have lost almost everything. It's 6 a.m. at the Weekly Inn Kitchenettes Motel.
Are you almost done?
And Darlene Lopez, Jacob Flores, and their 3 children are trying to stay afloat themselves.
Because we got to go take Maria some paperwork, don't we?
This family has seen its comfortable middle-class life unravel. Jacob's work as a tree trimmer is seasonal. Darlene got laid off from her $65,000 job in the mortgage industry. For them, being homeless doesn't just mean losing their 5-bedroom house. They lost their car, their insurance, everything but each other. Are the kids going along, getting along?
You know what, my kids are very resilient. They just, as long as we're together, that's all that matters to them. They'll go through anything with us. They haven't been negative at all. They've just been very positive, really supportive of our situation. They're very good kids.
Each morning, they ride 2 public buses to take their youngest child, Samantha, to school. They struggle to have enough money to feed the kids, much less afford health care. You used to have your own primary care physician.
Yeah.
You were insured, you said, by Cigna.
Oh, I couldn't afford it without insurance, and I'm not working.
You didn't even think about going back to your doctor?
No, I couldn't afford it.
Or to the private hospital that used to be your neighborhood
I
hospital?
couldn't afford it. There's no way.
What saves them is Denver Health's West Side Community Health Clinic.
We don't have no resources to pay rent, so that's why we're in a shelter. We don't have no resources for food. That's why we have to go apply for, public assistance.
Oh, man.
And that's why we're here, because we can only afford Medicaid. Before we were able to have an HMO and have private doctors. Before, now we're not able to because we have to come here because we're on Medicaid.
She's at 4 feet, 10 inches and a half.
Since families like this can't afford to see their old primary care doctors, there's little chance to nip an illness in the bud, which leads to more emergency room visits, more serious illnesses, more costs for the system to bear. It is a vicious cycle that this community clinic is trying to break.
I'm just grateful that she can get a wild child check and make sure that she's okay, healthy. Because if I don't know my kids are healthy, then that'll be another thing on the plate that we have to be concerned about, and that's one thing we don't have to worry about, at least.
If you can get patients into a lower cost setting like this, where we don't have all the high technology of an emergency department because we don't need it, we can provide care at a much lower cost.
Dr. Paul Malinkovich is Denver Health's Director of Community Health Services. The community clinics, along with a dozen school-based clinics, offer the kind of care that keeps people from becoming desperately ill.